Hello and welcome to the program. I'm Sophie Scott. Coming up, a look at the health system in India and the Australians who are trying to help with the issue of mental health in the country. But first, as the population ages, hearing loss is affecting more and more Australians. But thanks to an Australian invention, the Cochlear implant, it's a disability which can in many cases be resolved almost at any age. Just ask David Archer.
David Archer is a busy man. Every weekday from 9 till 5, this is where you'll find him, in the workshop at his retirement village on the outskirts of Sydney. At 91, he still has a dream.
You have to do something with your life. It has to be worthwhile living. You know what I mean? If it's not productive, what's the use of being here?
You got it? Right.
After his wife died, David Archer needed a project, and this is it. He calls it the Archer Diamond, built from scratch.
That's it. Now. There we go.
Today, as the plane nears completion, 4 generations of the family are here to take a look.
The single seater is a nice and tight one. I've been in tighter ones.
David Archer's love of flying goes back a long way. As a young man, he joined the Air Force hoping to be a pilot.
And when it came to the test for hearing, they found this. He was quite good. When they got there was a slight drop in it. I was kicked out.
Instead, David Archer joined the ground staff and learnt all about the mechanics of planes. Later in life, as a civilian, he did get a pilot's licence, but as his hearing worsened, he had to face facts.
I couldn't hear the other aircraft properly. Couldn't hear the thing. I was guessing at what they were saying, so I stopped flying.
In recent years, the family noticed this gregarious father, grandfather and great-grandfather changing.
His hearing had deteriorated to the stage where it was so difficult for him, he was actually giving up keeping in social contact with people.
The biggest thing was at family dinners. For me, that's where we would see him the most, and I guess he'd be very quiet and feel like he's off to the side.
So, how are you going?
No, I'm well, thank you, dear.
Yeah.
But then David Archer discovered he was a candidate for cochlear implants.
After the implant, it's as if a switch had been flicked. He was back to who he was supposed to be.
Yes.
David Archer's audiologist Monica Bray says people wrongly assume that cochlear implants are only for younger people.
The average age is 75, and people in their 90s are coming for assessments and having implants.
Now he can hear air traffic control loud and clear.
Bravo Romeo, you're about to be joined in the circuit with another Robbie 22.
It's great to be able to carry on conversations with him and see him confident in what he's doing. Even seeing him be able to interact with the kids in a way that he couldn't do before.
He's smiling.
Yeah.
David Archer reckons his plane will be finished by Christmas. His ultimate dream is to fly medical supplies to people in the bush. But first, he just wants to once again take to the skies. David, have you thought about what it's going to be like that day when you're on the tarmac, getting ready to go on the first flight?
I'll be that excited. You can just imagine flying my own aircraft, taking it off, testing it.
Some people might think a 91-year-old man to build a plane and then fly it himself is crazy.
Well, they might be right too.
Tracy Bowden with that report. For governments across the Asia-Pacific, mental illness is emerging as a critical health issue. In India, it's a massive challenge with a huge gap between the number of people needing treatment and the capacity of the health system to deal with them. Now, mental health workers in Australia and India have agreed to collaborate to tackle the issue. Gavin Fang reports.
In India, the scale of the mental health challenge is enormous. In India alone, there's up to 36 million people with serious mental illness and up to 120 million people with common mental illness. These figures are staggering, and yet between 65 and 90% of these people do not receive any form of treatment.
And with the rapid pace of development in the country, it's likely mental illness will continue to grow.
You've got, on the one hand, unrecognised cases coming to attention. On the other, the stresses of those transitions from what has been a predominantly rural lifestyle to a mixed urban economy, in many instances with minimal supports, poor housing, and people living on the outskirts of the city with significant movement that is necessary for them to find work. These are major forces, societal forces that are transforming society in India, and we know that those are often associated with mental illness.
The Indian government is now starting to recognise mental illness as a critical health issue. Associate Professor Chee is from Melbourne's St Vincent's Hospital. He's just returned from India, where the hospital, the University of Melbourne and the AsiaLink Foundation signed a deal to collaborate with the Indian government to improve the country's mental health system.
The large part of the population actually do not have access to services that are actually reaching out into the community. Secondly, there's also the lack of mental health workforce, the lack of trained professionals who are able to deliver appropriate care.
Professor Bruce Singh was one of the driving forces behind the agreement, and he says the stigma of mental illness is one of the biggest challenges in India.
People are less willing to recognise when a family member is ill. They're less willing to bring that family member to treatment. They're less willing to keep that family member in the home, or in a sense have the family member return to the home because of the stigma associated with mental illness.
That's meant that traditionally in India, the mentally ill are treated in asylums.
There has been neither the means nor particularly the will to try to deal with that population.
Chee says that's one of the issues the joint Australia-India mental health collaboration will address. With money from the Indian government, pilot projects will be set up in 4 different parts of India to find the best ways to treat people within their communities. One will be in the city of Chandigarh, another will be in a semi-urban area of Madurai. In Gujarat, the pilot project will be set up in a rural setting. A tribal area in Ranchi has been chosen for the 4th project.
These places are actually very diverse region, and so when these pilot sites are developed, they will provide a form of best practice in that particular setting, in that particular culture that is appropriate to that region.
In India, many mentally ill people go to temples to be treated by faith healers. Earlier this year, the ABC's Foreign Correspondent program visited one of the most famous in Avadi. What they found was disturbing, with black magic and possession by spirits blamed for mental illness. But Professor Singh says it's critical to get religious leaders on side.
If they can be brought on side, educated in the basic principles of how you recognise significant mental illness, and where you could get help for people who need help, more severe, significant help. That's a critical element.
The World Health Organization says across the Asia-Pacific, about 220 million people have a mental illness. Already, 17 countries in the region are collaborating to tackle the issue. So it's hoped the lessons learned from the work in India will help in the treatment of patients right across the region.
It is not a one-way street. It is about trying to learn from each other and trying to see that how we can come up with hybrid models of care, because mental health is not just a problem for one country, it is a problem globally, and we need to find more innovative ways of tackling this globally.
The pilot projects in India will report back over the next 2 years.
You need to use the established community structures in order to work most effectively. And so part of what we're trying to do in this project is to see what works in each country and share the learnings amongst the countries so that they can take the parts of it that seem most relevant to their society and implement them.
A new strain of flu is hitting primary school kids hard. Dozens of children have reported experiencing pain in their legs so severe they're unable to walk. While the symptoms are alarming, doctors say the condition lasts a few days and parents shouldn't panic.
Meet Tom Bate. The 8-year-old was unable to walk this week, struck down by a reaction to the latest strain of flu.
It was like a shot of pain when I moved my legs.
He's one of dozens of kids around Melbourne who has suffered severe pain in his calves after having the flu.
But I could walk like a zombie, like that, but that would take hours.
So he reverted to crawling around the house.
Well, he wasn't able to walk for a good 2.5 days, and he's only back up on his legs today.
Tom's case isn't isolated. 3 of his schoolmates have also been left unable to walk. One school in Sandringham has reported 8 cases. The condition is called myositis. Doctors say it's a common symptom of influenza that's more prevalent this year.
We've been seeing quite a few children with aching muscles, particularly calves, some of whom aren't able to walk because of the pain. They're not paralysed, they've just got such severe pain that they can't walk.
Dr. Starr says the condition doesn't last long and can be prevented.
The influenza vaccine can be given each year from about March and can prevent influenza and therefore prevent this sort of illness.
Tom's now enjoying his renewed mobility.
I can run away from my sister.
Tom's message to other sufferers is you'll soon be back on your feet.
And that's all for this edition of the Health Quarter. You can get more health news at the ABC's Health and Wellbeing portal, abc.net.au/health. And we'll have another Health Quarter in a fortnight. Bye for now.